family predisposition, it is asthma until proved otherwise.
Okay, so how do we now know that this particular wheezing or breathlessness is as a result of asthma,
Yes.
the diagnosis?
Yes. Now, doctors always say that all that wheezing is not asthma. First of all, you must have the symptoms. Then secondly, you must also have the genetic predisposition. Then the symptoms, there are cardinal things about the symptoms. If the symptoms occur in the night, if the symptoms are precipitated by these exogenous factors we talk about, if the symptoms have response to what we call beta-2 agonist, we can say it's asthma. Then we now do other measurements, which we call physiological measurements. In that physiological measurements, we take a patient to an instrument we call a spirometer, and it blows in as fast as it can, and then through some other tests we'll do, we can pinpoint that this patient is asthma. But there's another simple way which we diagnose asthma. This happens in children. Sometimes we tell somebody to exercise for 6 minutes. If he has asthma, after the exercise he will wheeze, because almost every asthmatic will be induced by exercise. And so that is a very simple way of diagnosing asthma. So you use your symptoms, the frequency of the symptoms, allergies occurring in the night, and also the fact that the patient will do some spirometry and some exercise tests. There are more complicated tests which you can do, but I think basically almost 99% of asthmatic can be diagnosed with a simple physiological test and the symptoms of the patient.
Okay, so if we want to be sure that this is not any other thing, we need to look at all of this, and that means the patient must be taken to the hospital.
Yes. You see, I've had a situation in which a patient had been given antibiotics for over a month, and because he was wheezing, he was coughing, and some people thought he had chest infection, and really he had wheeze. He had asthma. Now, if that patient had not been diagnosed, he would have died. And some will say that he died out of infection. So whenever a patient has wheeze, he has chest pneumonia, don't assume that patient must have physiological measurements. But I also want to say that asthmatics have a poor perception of the asthma. What we mean by that is that if their symptoms are serious, they may say it's nothing wrong with them. So that because of their poor perception, they don't have, if you don't do any objective measurement to measure their asthma, the patient may be dying and you say, I'm doing well. And that's why many asthmatics die, because they have their blunted perception of the state of their health. And so they need to see a doctor who will do the measurements that are necessary to diagnose asthma.
So if you have this wheezing, recurrent wheezing, and all of the symptoms that you've mentioned, don't just think it's something, okay, I can wake up out of this, or just get better. It's something you need to seek help for.
Yes, you need to seek help, because several people, you see, we always say that about 250,000 people worldwide will die every year because of asthma. I would say they will die because they are underdiagnosed and because they are undertreated. And in fact, because they are not even diagnosed. So diagnosis is one of the big factors, because death for asthma is vastly preventable.
Okay, now I know that there are different levels. Some people have mild, and tell us about this, and perhaps maybe this could account for why some people would think, well, this is not asthma. I'm not having asthma. It's just a one-off thing,
Yeah, there are so many myths about asthma. Some people say, well, because I had asthma when I was young, but now I've gone over it. Well, doctors not completely agree that you can get over your asthma. Although some people talk there's a rule of third, that some people will get over the asthma, some of the asthma will stabilize, and some of the asthma will worsen. But we don't believe that they can get over the asthma, all that.
Okay, so sorry, let me just add this. The symptoms, like we have on the screen right now, so we have the types of asthma.
Okay.
You've talked about exercise-induced.
Yes.
So could it be, this severity, could it be as a result of the type of asthma that person is having?
Well, the severity of asthma varies. You see, when you have an adult asthma, you are likely going to be more severe than if you have a childhood asthma. If you have asthma that is usually triggered by allergens, you are going to be less severe than asthma that you cannot get an identifiable allergens. But if for any reason you are waking up more times in the night because of your asthma, more nights in a week because of the asthma, and your asthma is not responding to your normal inhalers, and there are different methods of inhalers. And then you also need to take additional drugs to get your asthma controlled, or you have recently been admitted because of asthma, then you are at risk of having severe asthma. And that patient will need to be managed properly, because that could also lead to a progressive decline in this condition.
Okay, so quickly, let's talk about the aspect that, okay, if the attack starts now, how long will it take for the person to say, okay, mine is mild, my asthma is severe?
Yes, there are some things doctors always look at if you say your asthma is severe. One, if your asthma is severe, you have a lot of what I call, you find it difficult to breathe. You also find it difficult to complete a sentence. You see, you're not speaking monosyllables. Then your breathing would increase more than normal. Your heart rate would increase more than normal. And also, you find out that when you do the normal spirometry test you normally do, it will be far, far reduced more than normal. Then you are not responding to conventional drugs, the inhalers that you normally respond to. Then it shows that your asthma is getting severe. So your breathing, your heart rate, how you feel in terms of anxiety and not completing sentences, then your asthma is getting more severe.
Severe. Okay, we'll just go on a quick break now, and World Health Matters returns. We'll be talking more about how to manage this and, of course, prevent recurrent attacks of asthma. Stay with us on the program.